Hi guys, in this video I'm talking about men and breast cancer, and the reason I'm making this video is because there is so little awareness about male breast cancer. There's a lot of awareness about female breast cancer, but really most men are not aware that they could develop breast cancer. About 1 in 1,000 men will develop breast cancer in their lifetime. And because of this lack of awareness, when a man feels any unusual changes in their breast tissue, they usually will not report it to their doctor. And so a lot of men are diagnosed with breast cancer at later stages than women, unfortunately. So some important symptoms to be aware of are, of course, any lumps or any swelling of the chest area or the underarm area, any changes in the skin, such as any dimpling or any puckering in the skin, and any changes to the nipple, like redness, scaling, if the nipple is turning inwards towards the chest wall, and if there's any discharge from the nipple. Those are all symptoms potentially of breast cancer and should be brought to medical attention. Now, if a man is diagnosed with breast cancer, it's important for him to undergo genetic testing, because about 1 in every 5 cases of male breast cancer is due to an inherited genetic mutation. And that's important for 3 reasons. One is for treatment purposes. Male breast cancer that is hereditary can be treated with different types of drugs. And it's also important because men with mutations in certain genes can be at higher risk to develop other types of cancers. And of course, it's important for family, because if a man carries a genetic mutation, then his close relatives could also carry that same genetic mutation, and they may be at risk and can take certain steps to reduce their risk. One of the most important genes linked to hereditary male breast cancer is a gene called BRCA2, and having a mutation in this gene is associated with an up to 10% lifetime risk of male breast cancer. So men with a BRCA2 mutation are recommended to follow closely with their doctors and have annual clinical breast exams, starting at age 35, which is where the doctor will check the chest area and the underarm and make sure that there's no unusual changes. And these men should also actually be trained in breast self-exams. So once a month they should check their chest area and underarm and make sure that there's nothing unusual. Aside from BRCA2, there's other genes as well that can be associated with male breast cancer, such as BRCA1, PALB2, CHEK2, and ATM. The risks are not as high as for BRCA2, but there is newer evidence showing that these genes can also be linked with male breast cancer. Men with breast cancer should undergo genetic testing through a multi-gene panel to include all of these genes and any other genes that could be associated with male breast cancer. Now, when a man is diagnosed with breast cancer, he might feel a little bit isolated because he probably doesn't know any other man who has had this type of cancer. So in the description box below, I'm going to link to some support groups that have been created specifically for men with breast cancer. You might find that to be a helpful resource to connect with other men who've gone through this before. And I'm also going to link to the National Society of Genetic Counselors so that you can find somebody near you who can help guide you through the genetic testing process. Thank you so much for watching this video. If you liked it, please give it a thumbs up. And if you don't want to miss any of my future videos, subscribe and hit the notification bell. Thank you again. Bye.